So, hi, I'm Tamara from the EFT Training Centre, and I'm so delighted to have with me today Sue, who has actually had the COVID virus. She's also an EFT practitioner, and you're going to share a little bit about your experience of having the virus and how EFT tapping supported you in that. Is that right?
That's right, yeah.
Fantastic. Thank you so much. So tell me a bit about when you got the virus. How did you conclude that it was the virus? And yeah, we'll start there.
Okay, so I started coughing on the 25th of March, and I remember that it was that day. It was the Wednesday after the lockdown. I recognised that it wasn't a cough that I was normally familiar with. I also felt quite clammy and a bit feverish. The context of this all is that I'm married to a doctor. I have two children that are doctors, whose partners are doctors. And so everyone is very much aware of all the danger signs. Not only are they doctors, they are in anaesthetics, ICU, A&E. So
Wow.
we were hyper aware of any implications. And of course, being over 60 and having had things like chronic fatigue and things like that, am I in that sort of category? I don't know. But I was aware that something wasn't right, and alarm bells started ringing. Particularly for my poor family, who knew far too much, and of course they were getting into all the protection gear, all the going in, all the seeing of these new patients, and so I personally did not suffer from COVID very badly. I definitely had it, and some of the symptoms that I displayed, like I lost my sense of smell for a while, lost my sense of taste. Things tasted really weird. I got pins and needles, a lot of joint pain, and the fevers and the cough they would very much spike. At the time, the illness was so new, really, that one of the family would say, "Oh, well, that's not a COVID symptom," and then it would be evidential that it was a COVID symptom.
Wow. Yeah.
And one of the things that we were discovering, because this was early in the days of COVID really,
Yeah.
was that there are so many different ways that that a sufferer of COVID will display symptoms. So there'll be a different symptom spectrum for everybody. It may last a different length of time. And of course, as we all know, the severity is so variable.
Yeah. Wow. Thank you. And so once you were sure it was COVID and it was in full swing, when did you decide to do some tapping?
Oh, straight away.
And
Straight
what
away.
and what does your family think about tapping, given that they're all doctors and things?
Um, shall we say variable? I think that,
Okay, fair enough. And what kind of things did you tap on?
well, first of all, it was the highly charged state that I was surrounded with.
Oh
I
yeah,
wasn't quite so concerned about my own welfare, which is a paradox, really, because I perhaps I should have been, but I wasn't.
yeah,
But I was concerned for them being concerned about me.
yeah.
So that
Interesting.
was where I started, because,
Yeah,
as I say, it was a very acute stage of the illness, and they were going into this really, really traumatizing situation. So it was really tapping on my responses to their responses. That was
yeah.
the thing that I started with, and
Interesting. Yeah,
it was very helpful. I did a lot of tapping, and it just calmed my system. And as we know, if you're calming your system, you're more able to deal with things in a rational manner.
yeah,
Um, Now, my husband, being a doctor, also he's not an intensivist, but he's also a doctor. he was really, really helpful in the way that he monitored things.
Brilliant.
So we agreed very early on that there was going to be complete transparency, complete honesty about how I was feeling. I said, right, okay, I'm not going to dumb this down, but I'm not going to over dramatize it all, because at this stage in the public arena, everything was so highly charged.
Yeah.
And there was all the news briefings, and there was the this and there was the that, and everybody was up here in intensity.
Yeah.
And the tapping brought that down. So we were able to together work through the fear, work through the drama, and give ourselves room to process, room to breathe, and room to take all the appropriate action we needed to.
Fantastic. And I know that for a lot of people there's difficulty with breathing and things like that. Did you have that symptom?
We actually got hold of a SATS probe, which was helpful.
And that's can you explain?
The SATS probe, what it does, it's the thing that clamps onto the finger,
Yeah.
and you can see what your oxygen saturation is.
Yeah.
Because what was coming out, and this also came from my kids' experience, that sometimes people, even when they presented in hospital and their SATs were really low,
Yeah.
they actually were not that symptomatic.
Oh, interesting.
So
Yeah.
that is a really interesting sort of little aside.
Yeah.
So I had one evening when I was finding it hard to draw breath, but I was also aware that it was an evening when I was approaching day 5, I think it was, which is a crucial day. And I was feeling quite stressed about it. So this was another opportunity to tap through that.
Yeah.
You know, and I don't know, even to this day, I don't know whether it was a COVID symptom or whether I was just overly stressed, whether I was anxious and therefore having a sort of mini panic attack, because I was aware of breathing faster and more shallowly.
Yeah.
But the tapping really helped with that and calmed it down and gave me that space. So yes, I experienced the shortness of breath just the once, unlike so many people.
Yeah, absolutely. And what's really interesting about tapping is that it's really good, like whether it's a COVID symptom with the oxygen, or whether it's anxiety or panic attack, tapping will work in or will support either situation. I don't know if you ever saw that video of the man who was on the cruise ship, the COVID patient, and he used it to help increase his oxygen levels while he was in hospital to prevent him going on a ventilator, which is just fantastic. So whether it's either or, tapping is going to be beneficial. And I wonder, did you ever use you probably didn't need it if you already, if that symptom only happened once, but there's the constricted breathing tapping technique. Are you familiar with that one?
I am familiar with it, yes, and I didn't feel the specific need to target that.
Yeah, because
So
there were other things.
there were no specific setup statements or tapping on the points, with a reminder, because I was aware of it, and I was, as I say, I was doing tapping a lot of the time. Whenever I became aware of anything that was giving me distress or dis-ease, I would tap. I didn't really like doing an awful lot of tapping on my face.
Yeah.
Because some of the main points, of course, are on the face. But I found that, the thymus point here was really helpful for me.
Mm-hmm.
And also, using the collarbone here.
Yeah.
And the finger points.
The finger points.
So
Yeah.
it was, that was the primary, way that I used tapping. And it would be, whenever I remembered, I would tap.
Yeah.
And I would feel the either the symptoms or the emotions just sort of moving through, steadying down, moving through, and I was really quite calm.
That's amazing. And I think that's what the way we need to be when our body is just going through something. The calmer we can be, the more we can just let the body do what it's doing, then it can do everything right in order to start healing itself.
Exactly.
And I think it's sometimes when our mind interferes with that process, when we get stressed about it, that can only exacerbate how we're feeling and
Yeah.
potentially increase, the adrenaline in the body, and then the body can't use all its resources to get healthy again. So
And particularly with something like COVID, when
yeah,
everybody is overthinking and
yeah,
over planning, and there is no certainty. So
yeah,
it was focusing on the here and now and just allowing that to be what it was.
beautiful.
And
Yeah.
Catherine really, really helped me with that.
Wow. And for those of you watching, if you're wondering what these finger points are, because I know most people who watch my videos are familiar with, the usual points, let me just show you where they are. So it's really the corners of the nails. So the corner of the thumbnail, which is closest um, to the body, so furthest away from these fingers. So this point on this side, this point on this side, and then the same point on the other fingers. Now you can miss out the ring finger, but you can also add it in, and then the side of the hand. So is that how you tapped on the fingers, or sometimes people like doing it like
I
this?
do it like this,
Yeah,
and also I do it with both hands at the same time, and it's just I I don't know what anybody would have thought of me, but do you know, it really didn't matter,
no,
and it's quite a sort of natural, gentle, soothing movement anyway.
yeah.
So yes, that's how I did it.
So if you're watching this and you've got COVID, and you don't know the words and you don't know the setup statement, at the very least you can just be tapping on your finger points, and that will help align your energy system, and you can take some deep breaths as you're doing that.
Mm.
So that's actually a really nice simple thing just to think about when if you do have it. So um, one thing that you mentioned, which I think is so important, is staying in the present moment.
Mm.
So I don't know if you would like to join me in doing some present moment tapping right now that could really support people.
Yeah, that'd
Um,
be lovely. Thank you.
Great. So um, if you're watching this and you've never done EFT before, it's like acupuncture for emotions without the use of needles. It stands for Emotional Freedom Techniques. It's also called tapping. And the invitation is to simply do what we do and say what we say. And if you don't like what we do or say, then simply don't do it. But if you do tap along with us, you agree to take responsibility for your own well-being. So when you think about being in the present moment right now, sitting here with me, um, I'm thinking about how we're going to do this. Um, on a scale from 0 to 10, 10 being the most present you could ever imagine yourself being, and 0 being completely unpresent, maybe out of your body, where would you put yourself right now on the scale, would you say? And
Mm.
whatever's there is absolutely fine.
Yes, I would say I was about a 7. I'm pretty present. Yeah.
Wonderful, wonderful. And for those of you watching also, just assess how present you
Mm.
feel right now. And even if you're at a 10, we can even say, well, bringing even more presence energy into our systems, which is, I think, what we'll do now, is just because you are feeling quite present. So we'll just work on
Mm.
becoming more present.
Yeah,
So,
because there are thoughts that come and go, and that's fine.
yeah.
But feeling that grounded sense is
Mm,
great, really great.
good. So we're not going to start with, yeah, we will start with even though. So even though
Even though
um, some of me is feeling present right now,
some of me is feeling present right now,
and some of me could be a little bit more present,
and some of me could be a little more present,
and I deeply and completely
and I deeply and completely
accept both parts of myself.
accept both can I put in both of these parts of myself?
Of course, of course. And I was just about to say that, you know, if my wording doesn't work, please change it. Because, of course, we've never done tapping before. And as you know, together, that is. And as you know, it's all about what works for you. So thank you for changing that. In fact, I've forgotten what you said now, but
Both of these parts.
both of these parts of me, thank you. So we're just going to go straight into tapping through the points, starting with the top of the head and saying, part of me feels present right now.
Part of me feels present right now.
And then moving on to the eyebrow. And part of me doesn't feel that present.
And part of me doesn't feel that present.
And I'm acknowledging that part of me.
And I'm acknowledging that part of me.
And giving it space.
And giving it space.
I'm breathing into that part of me now.
I'm breathing into that part of me now.
And just take a deeper breath now. And I'm noticing my feet on the ground.
And I'm noticing my feet on the ground.
And my body in the chair.
And my body in the chair.
And the part of me that isn't quite present.
And the part of me that isn't quite present.
That part of me that isn't quite present yet.
That part of me that isn't quite present yet.
I wonder what it needs.
I wonder what it needs.
In order for me to feel a little bit more present right now.
To feel a little more present right now.
Maybe it needs acknowledgement.
Maybe it needs acknowledgement.
Is there something that comes to mind when you think about that part of you that isn't so present?
Yes,
what it might need?
Yes, it's really interesting. As we were doing that, I was aware that that part is very much associated with my mind and to do with safety and to do with planning. There's a part of me that is very happy to be just here. But that part of me, it's a part that's really kept me safe, but it's having a little bit of a panic now. That's what it feels like. And it's all to do with the thoughts.
Thank you. I think that's
it's almost like a little person, in fact.
Yeah, I mean, I think I definitely can relate to that part that is like planning, and I definitely have that part of me as well. And I think a lot of people will be able to relate to that. So that's really great. So even though the part of me that isn't quite present right now,
the part of me that isn't quite present quite now,
is my mind.
Is my mind.
And it does a great job in keeping me safe.
And it does a great job in keeping me safe.
And it likes to plan.
And it likes to plan.
And it's having a bit of a panic right now.
It's having a bit of a panic right now. It's really funny. I'm quite visual, and it's wagging its finger at me.
And it's wagging its finger at me.
And it's wagging its finger at me.
And I'm just acknowledging that.
And I'm just acknowledging that.
With curiosity.
With curiosity. And humour.
And humour, thank you. It's wagging its finger at me.
It's wagging its finger at me.
It's having a bit of a panic.
It's having a bit of a panic.
And if it had words, what would it be saying? And maybe there aren't any.
There aren't actually. It's just looking at me and with its eyebrows raised. Sort of, what do you think you're doing? Are you sure you're okay? It's not actually saying those, but that's the feeling I'm getting.
Yeah.
It's not seriously panicked.
Yeah.
But it's just, it is curious. I think it's funny, but it is curious.
It's curious. And it's wondering.
And it's wondering.
If I shouldn't be, did you say if I shouldn't be planning or?
Looking out for the future is what comes to mind.
It's saying I should be looking out for the future.
It's saying I should be looking out for the future.
And what And the other part of me
And the other part of me
knows that what's in my best interest right now
knows what's in my best interest right now
is to stay present.
is to stay present.
So I'm wondering if that part that is focused on the future, whether it needs, does it need something like trust?
It's a bit more relaxed. It's definitely a bit more relaxed, but it's got his arms folded now.
It's a bit more relaxed,
It's a bit more relaxed,
but it's got its arms folded now.
but it's got his arms folded now.
And I'm acknowledging that.
And I'm acknowledging that. And that's interesting because it does need acknowledgement.
And it does need acknowledgement.
It does need acknowledgement.
So I'm giving it as much acknowledgement as it needs right now.
So I'm giving it as much acknowledgement as it needs right now.
I'm not judging it.
I'm not judging it.
I'm not ignoring it.
I'm not ignoring it. I'm appreciating it. I need to appreciate it.
And I need to appreciate it.
I need to appreciate it.
And does that feel like something you can do?
Yeah, definitely. Definitely.
Yeah.
It's like having two children, and you're focused on one, and you know you care about the other one, but you're not necessarily at a particular moment in time giving it quite the attention that it needs, and so it needs to have a little strop in order to get your attention. That's the sense of it.
Yeah, wonderful. Thank you. So I'm giving it the attention it needs right now.
I'm giving it the attention it needs right now.
And just breathing into that.
And now it's smiling.
Say that again.
Now it's smiling.
Wonderful. And has it still got its arms crossed?
Yes, but quite relaxed.
Quite relaxed.
Yeah.
So on a scale from 0 to 10 right now, how present would you say that you feel right now?
I would say about a 9, because there's a real sense of contentment.
Thank you. There's
good.
Wonderful. And there's a real sense of contentment right now.
There's a real sense of contentment right now.
My planning mind.
My planning mind
is more relaxed.
It's more relaxed.
And the rest of me is feeling more present.
And the rest of me is feeling just as present.
Just as present, thank you. And I'm coming back to my feet on the ground.
I'm coming back to my feet on the ground.
And my body in the chair right now.
My body in the chair right now.
And if there was an image of feeling grounded and present, does anything come to mind that would support you feeling even more grounded and present? I
don't think so. I mean, the word that comes to mind is integration.
Integration, beautiful. I want a little bit more integration.
I want a little more integration.
Of the part of me that's present.
The part of me that's present.
With the part of with my mind.
With my mind.
That likes planning.
That likes planning.
So I'm open to the possibility.
So I'm open to the possibility.
Of infusing integration energy.
Of infusing integration energy.
Into every cell.
Into every cell.
Every atom.
Every atom.
Every molecule.
Every molecule.
Of my whole entire being.
My whole entire being.
So that more of me can feel more present.
So that more of me can feel more present.
More of the time.
More of the time.
Bringing integration energy.
Integration energy.
And present moment energy.
And present moment energy.
Into the rest of my day.
Into the rest of my day.
And the rest of my night.
And the rest of my night.
Helping me sleep well.
Helping me sleep well.
Deeply.
Deeply.
Feeling rejuvenated in the morning.
Feeling rejuvenated in the morning.
And deeply present.
And deeply present.
And just put your hands in the center of your chest and say the word transform and take a deep breath. Transform. So how are you doing?
Good, good, thank you. That's I can always tell with the tapping if things are landing because I have more space.
Wonderful.
For me, having space is really important. I can tend to be very busy, and the space in between needs to be as much as the tension of the activity. And this has provided just a lovely little buffer of space. Thank you.
Oh, you're very welcome. Well, thank you for sharing your story, and thank you so much for yeah, just sharing your story, doing the tapping, and then tapping with me now, because that, of course, is going to support the people watching. So just to say, for those of you who have been watching, if you've enjoyed this video, then please do click on the share button, because there is a virus out there and it is affecting a certain percentage of the population. But there's an even bigger virus which is affecting pretty much all of us, and that's the fear virus.
Mm.
And I really want tapping to help and support people overcome this fear virus. So the more people can do it, the more people can benefit. And maybe it can reduce some of the symptoms of the virus for those of you who are watching it, to help you in this video become more present. So thank you, stay strong. If you're watching this, you're doing a great job, and I will see you in the next video. Bye.